is the Shoulder and Elbow Institute of São Paulo, Brazil. This institute works with the RAMSES in the hospital, Sírio-Libanês. It's the only hospital with training of the robot in Brazil. And we began the way making brachial plexus surgery, in open surgery. And then we thought we had to go further to improve skills, to improve the indications for surgery. This was 4 or 5 years ago. And then we started to make thoracic outlet syndromes, but just not osseous thoracic outlet syndromes. But we want more. We want to go to the appendicular nerves and muscles, and the ulnar nerve is one of our aims. And the ulnar nerve has many points of compression. When you flex the ulnar nerve, the nerve has 7 times in 11 of the pressure. You can have anomalous muscles. And the idea was to make an anterior translocation of ulnar nerve made open, but it was just the beginning. We, as Philippe told, we need to move to endoscopic surgery, and we moved to endoscopic surgery for the ulnar nerve. This was published, and we made the decompression of the ulnar nerve all endoscopically with small portals, just small portals. Here you can see the surgery. Here we have the first portal just above the ulnar nerve at the middle of the arm, and you go to the forearm, liberating the ulnar nerve. This surgery was a very complicated surgery because of many scars, was 3 times previous surgeries, this patient, and then we have to release the nerve, all the scars around the nerve. Not so easy. Here you can see the nerve, the beginning of the release of the nerve. And here we are in the elbow. Then we moved from the arm to the elbow in the same portal. And the release was done until the forearm. Here the osmotic arcade, the last point of compression, and all the ulnar nerve released. But you need more. You need to move forward, and the quadrilateral syndrome is one of the things we need to understand better and make some solution, because the open solutions use very wide ways. Here are the exams, but we have a difficult surgical approach, not cosmetic, very large, and the solution was a robotic approach. We made this in 2 cadaver models. We are trying to make some in live models, but in 2 cadaver models we have now another way to see these nerves in the posterior part of the shoulder. And not just the nerves. This is very similar to the Jess made to the latissimus dorsi, but we see other side. We see to the shoulder, and Jess see to the back. Here is opening the quadrangular space, and you can find the axillary nerve here, where the entrapment happens. Well, with this, the route brings technology, new possibilities, allowing the surgeon to perform quadrangular space exploration by using their robotic hands in minimally invasive procedure. This cadaveric experience established a robotic surgery technique that's going to be used in live patients in the near future. But we are moving on from nerves to muscle transfers. One of our main concerns in orthopedic surgery are some muscles transfers around the shoulder that use this large approach. As Jess used the same large approach to the latissimus dorsi. And this is the surgery. And our answer, could the posterior approach of latissimus dorsi be performed by a minimally invasive procedure? Well, as we showed you before, it's possible to see the quadrangular space, and just now in the quadrangular space we can see the latissimus dorsi insertion. Then we're moving to not so latissimus dorsi. We're trying now the infraspinatus, the subscapularis, and the pectoralis major transfers by using the same way. This was the same docking for the robot. We used in beginning the same way the Jess made the surgery, but you looking at the shoulder. Here the radial nerve and the insertion of the latissimus dorsi. Well, the robotic technology brings new possibilities, allowing the surgeon to perform the latissimus dorsi flip flaps transfers by using the robotic hands in a minimally invasive procedure. The endoscopic exploration of the latissimus dorsi tendon and others are just the first step to the endoscopic transfer for massive rotator cuff lesions. Thank you very much.